31% of men and 29% of women in India are reported to be overweight. Junk food, cold drinks, and sedentary lifestyle is leading us on a road towards unhealthy living. For morbidly obese people, along with dietary restriction, physical workout and medicines, now surgical help is available. With the advancement in medical science and technology, bariatric surgery is one of the ways to fight obesity and change their life for the better.
Bariatric surgery as such is a specialty where we tend to work surgically on correcting morbid obesity, we call that as. When it comes to the types, we have two types, of which one is called the restrictive bariatric surgery, where we restrict the intake alone. Then we have something called as malabsorptive technique. Malabsorptive technique is a technique where we reduce the absorption of the nutrients what we eat. And we have something called as a combined procedures, which combines both restriction and malabsorption together. Most of the bariatric procedures are all the combination procedures. So for example, we have something called as sleeve gastrectomy or stomach stapling, which most of the people know. It's just restricting the size of our stomach alone. We talk about a bypass, which again people commonly know as a bariatric surgery, where we combine restriction as well as malabsorption. That gives the longevity in weight loss and comorbid resolution. We have an upcoming third procedure called mini gastric bypass, which has been very famous in the last couple of years.
Not all obese people are eligible for bariatric surgery. The selection is based on calculation of the body mass index or BMI, followed up with a diet regime prescribed by a nutritionist. A bariatric patient should have a BMI of 32.5 and above, with comorbidities like diabetes, sleep apnea and hypertension, or a BMI of 35 and above without comorbidities. After any bariatric procedure, the weight loss is gradual. On an average, a person loses about 5 kilos every month.
The moment we plan to discharge the patient, we normally, first thing is about the diet chart, what they need to follow. The diet chart carries only for a month's time, because it takes a month's time for them to get back to regular normal diet. First week of liquid diet, second week of semi-solid diet, third week of soft diet, only in the fourth week we go to normal diet. And how to do that as well? Because stomach is smaller, we can't eat bulk, at the same time need energy, so we increase the frequency. For example, we say 3 meals and 3 snacks. 3 meals or 2 snacks, or 3 meals or 3 snacks is a must a day. Whether like it or not, we have to take it. One. Second, liquids, sip and not use a straw. And chew and eat, not gulp.
Frequent follow-ups with the doctor is a mandatory practice post-bariatric surgery.
Their body is so heavy, when you operate, it's a big height, so you have to operate very uncomfortably. For that, we need to have a table which is capacity of around at least 450 kg capacity, which can go low. And behind me you can see the laparoscopic trolley. What exactly we talk with trolley is, it's called the image station, where whatever we operate through the laparoscope will be captured by this instrument. So our experience is much more in laparoscopy, so which is the best solution what we can give.
In a laparoscopic gastric bypass bariatric surgery, small cuts are made in the belly. One of these cuts is used to place a tiny camera called laparoscope, which is connected to the video monitor in the operating room. And through the other cuts, thin surgical instruments are inserted for the surgery. Gastric bypass involves creation of a gastric pouch by cutting the stomach. The small intestine is segmented into two, with the second part being reattached to the stomach pouch. The first part of the small intestine is joined again to the second part, bypassing a significant length of the second part of the intestine. Now the food travels directly from the pouch to this new opening into the small intestine. Because of this, the body absorbs fewer calories and facilitates in losing weight. The procedure for mini gastric bypass is quite similar to that of the laparoscopic gastric bypass bariatric surgery, where through cuts a gastric pouch is created which is joined to the small intestine. However, gastric bypass is a largely restrictive surgery with less malabsorption, and mini gastric bypass is largely malabsorptive and less restrictive. The aim, however, in both cases is to make the body absorb fewer calories and facilitate in losing weight.
So people who are very obese and people who are very tall, it's pretty difficult to do laparoscopic stuff. Basically, we have to extend our hand way beyond, because of huge patients, way beyond to operate. So it's pretty difficult to handle those people laparoscopically. Whereas when you talk about robotics, however big the patient can be, however tall the patient can be, we do on a console and the robo arm operates on the patient. So this scenario makes life more easier for surgeon in a heavy patient. One. Second, another big advantage what a robo can give is better vision and better clarity. So we have something called as intuitiveness. Because of a 3D vision, what you see is like what you see in real life. You tend to be feeling like you are inside the patient's abdomen and operating. Because of a 3D vision, the instruments move much better, giving more mobility to the operation.
12,750 bariatric surgeries were performed in 2014, as against to 8,500 in 2013. With the number of bariatric surgery cases increasing every year, a relatively new technology called SILS, or single incision laparoscopic surgery, is set to revolutionize the art of scarless surgeries.
First reported case in the world for a SILS revision bariatrics also happened in Apollo. We are proud to say that. So we are the leading in India when it comes to wide range of SILS bariatric procedure. We go through a small incision in the abdomen through the umbilicus or the navel, so which is a normal scar. So the scar is buried after surgery. Go in, we have specialized equipments. All the specialized equipments, 3 or 4, go through the same hole, a 2.5 centimeter hole through the navel. We go in, and a lot of difference in the technology where we use the surgical techniques inside. Especially the most important part is the traction part, where we have designed a new technique of liver traction called as a Hattel sling, which goes under my name, which is proud for Apollo to introduce that in the world. And then we have done a lot of publication presentations based on that, where we lift the liver through a suture from within the abdomen, so that we don't need an additional traction, which is unique to our center and which is replicated in a lot of centers around the world nowadays.
Bariatric surgery is one of the efficacious options now available to morbidly obese people, making them move towards a healthier, longer and a more fulfilling life.